Johnson & Johnson has perhaps been the most scrutinized vaccine, but CDC officials are standing behind it, saying the benefits outweigh any risks, and still some are concerned about the drug's efficacy when compared to other vaccines. Fox 46's Robin Kennedy joins us now in the newsroom. And Robin, a lot of these concerns revolve around the potential need for a booster shot.
That's right, Brian. A doctor tells me boosters are likely for all three vaccines, but the timing is probably going to be different depending on which shot you got. And now, because there's a big supply, you can definitely pick and choose. It used to be that you didn't have a choice which vaccine you got at StarMed, but now you can pick any one of the three.
I just want one shot because I think it's good.
David Groom got the J&J vaccine, but Trevor Fuller opted against it.
I thought that the effective rate was too low, particularly when you had choices where the effective rate is much higher. I had some issue with the notion of one dose when everybody else is doing 2 doses.
A study by NYU came out this week saying a booster might be needed for the 1-dose J&J because it isn't as effective against the Delta variant as the other 2-dose vaccines. This study has not yet been peer-reviewed, and Johnson & Johnson says the study doesn't provide a complete look at how the vaccine works. Nonetheless, StarMed says they've been getting calls from people who got the J&J expressing some regret.
When we see all these reports out that it may not be as effective, obviously the people that are vaccinated want to make sure that they're safe.
Dr. Aaron Paramazadian with StarMed says don't worry about getting a booster right now. Wait on the CDC to make a recommendation.
Now, it does protect us enough to keep us out of the hospital and from dying. You know, the studies show that 99.5% of the people who are dying right now are unvaccinated.
Dr. Paramazadian says people are probably going to need a booster with all 3 vaccines, but the J&J booster might be needed sooner than the others. The doctor says the CDC does not yet recommend getting 1 dose of one vaccine and a 2nd dose of another because there's not yet enough information on that. But it's a possibility that could be approved for boosters. David says he'll get a booster if it's recommended.
I ain't gonna start nothing I can't finish. Anything I start, I try to finish it. I will come back if I have to.
Now, about 100 cases of Guillain-Barré syndrome, a serious but rare neurological disorder, have been reported in people after getting the J&J shot. The CDC says early data shows despite the risk of developing that disorder, the shot is still beneficial. Brian?
Robin, thank you. As vaccine demand falls off and restrictions ease, the number of new cases is rising. After weeks of declining numbers, Mecklenburg County seeing a jump in cases. New CDC numbers show we averaged 845 cases daily over the last week. That's an increase of more than 250 cases a day. Deaths and hospitalizations are also slowly starting to rise.